A 3-week-old infant presents with irritability, poor feeding, and a temperature of 38.9 centigrade. Physical exam reveals a bulging fontanelle. This is too easy. Delayed capillary refill and grunting. This one's too easy. That is classic. Okay? Sometimes, 3-week-olds, sometimes these babies do not have those classic signs and symptoms. Sometimes, especially preterm babies, might have just poor feeding and temperature instability. But that one is a classic presentation. So let's talk a little bit about sepsis in the newborn. So, like I said, nonspecific signs and symptoms. They may have poor feeding, temperature. Well, it's sepsis/meningitis. Sepsis/meningitis. How about that? Okay? Does that make you happy, Rika? Sepsis/meningitis. So nonspecific. They can have poor feeding, temperature instabilities, fussiness, irritability, difficulty to console, things like that. There are some of the risk factors. Remember, what did I say earlier? The newborns' past medical history is the pregnancy, labor, and delivery. So preterm babies, one reason is preterm babies don't fight infections off very well. Neither do term babies, preterm babies even more so. Plus, what could have caused the preterm labor? Maybe an infection. Okay? And then obviously infections in the mom can set a baby up for infections. These are the 3 common bacteria that cause sepsis/meningitis. Group B strep, now that is starting to decrease because of prophylaxis and treatments and all. E. coli and listeria. Okay? If we were to talk about viruses that cause neonatal meningitis, we would think of, tell me, Alejandro is talking about herpes. Alejandro, I'm glad that you're feeling better. I've been reading the thread over here. I'm glad you're better. Okay, so I hope your diet allows you to have a chocolate. All right, everybody's talking about herpes, okay? Yeah, it was your appendix, not your brain. All right, so that baby that I was talking about the other day, not the other day, earlier today, that came in last week and I've been teasing you. Yeah, it could be encephalitis, okay? Could be encephalitis, but it can cause meningitis, okay? We'll get to this baby in a second, okay? So these are the 3 common causes of bacterial causes of sepsis/meningitis in the newborn. Okay? How do we make the diagnosis? Okay? Well, the CBC, the diff, and the platelets don't tell you what it is. It's helpful. The blood culture can tell you about sepsis. A UA and a urine culture will let you know if there's a urinary tract infection. A chest X-ray lets you know if there's pneumonia. An LP lets you know if there's meningitis or not. Okay? So all of these things are helpful. Okay? So a CBC can show an elevated white count or a depressed white count. The differential helps you. A blood culture will be positive in bacterial infections, as would a urine culture. The chest X-ray may show pneumonia, which could be a setup for sepsis or meningitis. And if there's evidence of meningitis, you do an LP, or if you just think about it. So let's go back to our little baby. The baby that I've been talking about since like 6 in the morning, or actually 6 this evening. Could be 6 in the morning in Islamabad, I guess. So let me give you the history. This baby was transferred to us after having some apneic episodes at the referring facility. The mom had a normal pregnancy, labor, and delivery, but the parents state that the baby was fairly sleepy from the beginning. The baby weighed, I think, like 8 pounds at birth, lost some weight at the beginning, as babies do, and was starting to regain weight, and now at about 1 week to 10 days, I think, 10 pounds, 3 ounces. Mom had no issues during the pregnancy. The labor was okay, it was a vaginal delivery, and the baby went home with the mom. The parents noted at around, they said around birth, shortly thereafter, but certainly by a week of age, the baby was sleeping a lot and would feed a little bit and go back to sleep, voiding and stooling well. Was admitted to the hospital at about, I think, 12 or 11 days of age because of lethargy. And by a day later, was starting to have a lot of lethargy leading to apnea, and the dad described left-sided jerking of the arm. They called us because of the apneic episode. So our transport nurse went to get the baby. Before she went to get the baby, a CBC had been done, which was fairly normal. We recommended getting a blood culture, getting a urine culture, and starting antibiotics. And we recommended acyclovir. By the time our transport nurse got there, an hour later or whatever, the baby was having full-blown apnea, and she intubated the baby and brought the baby back to us. The baby had a cradle cap, some no other lesions. We performed an LP, which showed a normal protein, normal protein for the age, and a normal glucose. And the baby, I think, had like 57 reds and 40 some odd white cells. Okay? And the PCR for the CSF showed HSV. The patient had some seizure activity and an EEG of the left side, and an EEG showed right-sided focus, and an MRI showed a right-sided, pretty large area of suspected infarction. Obviously, we know this baby has HSV. That's what caused the MRI findings, and that's what was causing the seizure activity. Okay? Exactly. Temporal lobe. Huge clue. Okay? We don't make this stuff up. The baby was, just to give you follow-up, the baby's only 2 weeks old. The baby was extubated yesterday and is doing fine today as far as what does a 2-week-old do? They eat, they poop, they sleep, they pee, they sleep, they eat. Okay? But was started, by the way, on phenobarbital for the seizures and has not had any further seizure activity. But that's not a good prognosis. All right. So neonatal sepsis / meningitis, whatever you want to call it. Okay? We need to fix this slide, actually. The treatment of choice, whether there's meningitis or not meningitis, is going to be ampicillin plus an aminoglycoside. These are newer recommendations now. Okay? So ampicillin and an aminoglycoside if you suspect bacteria. Acyclovir for HSV. Okay?